Cellular therapy is developing nowadays, and there is some technicity, I would say, more technique, and we need really to be careful managing the patients. So the best way to do this is to harmonize practices across Europe, among centers. Why doing this? Because, as you know, clinical patient care is delivered locally, and practices differ from one country to another, even from center to center, or even in the same center, So we need something harmonized, between the practitioner, nurses, to better take care of the patient. I would say, to achieve the excellence which is required by JC accreditation. The problem is international guidelines are often too high level and do not address issues encountered in daily clinical practice, and do not address all issues, especially practical ones. So in the absence of well-established guidelines, what we do, actually, each center develops local approaches. This is the cause, or I would say this is the reason for the heterogeneity in practice, procedures between centers. EBMT, in association with the EHA, wanted to launch a joint effort to issue European guidelines to practicing clinicians and nurses and other healthcare providers, of course. These procedures will be, or recommendations, I would say, will be written in English to be usable by all centers, but also translatable into other languages. And what we need from those guidelines to be capable of being adapted for local use. Our goal, it's not just to copy and paste ready-to-use procedures, no, but to give, guidelines to be adapted for local uses. And also, we need to cover all practical issues, which is very important, and give usable guidelines where international consensus is lacking. Of course, we need to provide them in an easy-to-use format. For instance, copy and paste potential and, online accessibility of these guidelines. So in this way, we can provide, I would say, our clinicians across Europe, other healthcare providers with up-to-date, clear, and easy-to-use guidelines.